Bipolar disorder is a serious mental health condition. It affects millions of people around the world. This disorder is characterized by extreme shifts in mood. These shifts can range from manic highs to depressive lows. These mood swings can significantly disrupt a person's life. They can interfere with work, school, relationships, and overall well-being. It's important to understand that bipolar disorder is not simply a matter of moodiness. It's a complex condition with biological and psychological underpinnings. Individuals with bipolar disorder experience these mood swings with an intensity and duration that far surpass typical mood fluctuations. The highs and lows of bipolar disorder are debilitating. They can lead to serious consequences if left untreated. The good news is that bipolar disorder is treatable. With proper diagnosis and treatment, individuals with bipolar disorder can lead full and meaningful lives. Early identification and intervention are crucial. They can help manage symptoms effectively and prevent the condition from worsening. Understanding bipolar disorder is the first step towards seeking help and finding the right treatment path. This essay will delve deeper into the diagnosis, treatment options, and coping strategies for bipolar disorder. Knowledge is power, and being informed is crucial for both individuals with bipolar disorder and their loved ones. Diagnosing bipolar disorder is a multifaceted process. It involves a thorough evaluation of an individual's medical history, mental health symptoms, and lifestyle factors. There is no single test to diagnose bipolar disorder. Instead, healthcare professionals rely on a combination of assessments and evaluations. A physical exam and lab tests are often the initial steps in the diagnostic process. These tests help rule out any underlying medical conditions. Some medical conditions can mimic the symptoms of bipolar disorder. These conditions include thyroid disorders and certain vitamin deficiencies. A psychiatric assessment is a cornerstone of bipolar disorder diagnosis. During this assessment, a mental health professional, such as a psychiatrist or psychologist, will conduct a comprehensive interview. They will inquire about the individual's symptoms, their severity, and their duration. The mental health professional may also ask about family history of mental illness, as bipolar disorder can have a genetic component. Psychological self-assessments can be valuable tools in the diagnostic process. These assessments typically involve questionnaires or inventories. These tools help individuals reflect on their mood patterns, behaviors, and experiences. While self-assessments alone cannot diagnose bipolar disorder, they can provide valuable insights. These insights can aid healthcare professionals in making an accurate diagnosis. Mood charting is another important aspect of diagnosing bipolar disorder. Individuals are often asked to keep a daily record of their moods, sleep patterns, energy levels, and any medications or substances they are using. Mood charts help both the individual and the healthcare professional identify patterns and triggers. These patterns and triggers can provide clues about the nature and severity of the bipolar disorder. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, provides specific criteria for diagnosing bipolar disorder. Healthcare professionals use these criteria to ensure consistency and accuracy in their diagnoses. The DSM-5 outlines different types of bipolar disorder. These types include bipolar I disorder, bipolar II disorder, and cyclothymic disorder. Each type is characterized by specific patterns and durations of manic and depressive episodes. Diagnosing bipolar disorder in children and teenagers presents unique challenges. The symptoms of bipolar disorder in younger individuals can overlap with other common childhood and adolescent issues. These issues include ADHD, anxiety disorders, and typical developmental challenges. Children and teenagers may have difficulty articulating their internal experiences. They may struggle to differentiate between normal mood fluctuations and the more extreme shifts associated with bipolar disorder. In these cases, gathering information from multiple sources is crucial. Parents, teachers, and other caregivers can provide valuable observations and insights into the child or teenager's behavior. Misdiagnosis is a concern when it comes to bipolar disorder in young people. It's essential to have a comprehensive evaluation by a qualified mental health professional experienced in diagnosing and treating children and adolescents. Early and accurate diagnosis is essential for providing appropriate treatment and support. It can help mitigate the potential long-term impact of bipolar disorder on a young person's development and well-being.